Well, today's date is
October 23rd,
October 23rd.
2013.
This is Dr. Lee. Say hi.
How you doing?
Wait. It's focusing. Dr. Lee.
Hi.
So basically today what we're going to do is go over results of the MRI, of the scan, the CT scan,
right.
and my breathing test.
So, correct. So, the CT scan that was recently done, and I compared it to the one that you most recently had and then one that you had almost about a year ago. And what it shows is that the scarring in the lung or the fibrosis, it's progressed compared to the initial. Well, it's hard to really say like how much. It's definitely noticeable.
Okay.
If it was only a little bit progressed, it might be a little hard to tell, but it's definitely noticeable. So I think it's more than just a little bit.
Okay.
I wouldn't say it's like hugely dramatic on the CAT scan, but you can definitely tell the scarring has progressed. And the reason why we got that is because I think it also fits in with the pattern of the breathing tests, which again show a decline in some of the numbers that you would see if the fibrosis was getting worse.
Yeah.
And then kind of the third major component of that is, of course, your symptoms, in terms of what's happening with your symptoms. Just since you last saw me a month ago, just in general, how do you think your breathing is done? It feels the same? It feels worse?
Actually, I think it's getting a little bit worse.
Okay. The shortness of breath?
The shortness of breath is getting, I'm coughing a lot more now. The morning is the worst part.
Mm-hmm.
Where I'm starting to get headaches just from coughing from the pressure
Yep.
of the cough. I mean, just to clear my throat out, it's
Okay. All right. And you're still on the prednisone, right?
I'm
10
still
milligrams,
on
still
it.
taking it? 10 milligrams, right?
10.
Okay. All right. I'm pulling up your very first breathing test, which was in October 2012. So, if you're just trying to make a comparison here, and I think that's before you were on any sort of prednisone.
Uh-huh.
And, like your total lung capacity, which is basically a measurement of kind of how much air is in your lungs. Before you were at about 4.5 liters, and today you're down to about 3.2 liters. So it's a significant decline, more than a liter loss in terms of just overall lung capacity. And another number that we look at is the diffusing capacity, which is just again, it's a number that helps us give a sense of how much area of the lung is actually working to exchange gases and that kind of thing. And before your level was 17 and now it's down to 11. So this is a true drop.
Okay.
And again, it also correlates with a CAT scan, basically almost the exact same time period, 1 year, that shows that your scarring is getting worse. I think, in the interim, though, between the year that, you were on the prednisone, and with the prednisone, you actually did have some improvement in your lung function. And then, we've been trying to taper it down because of all the side effects and, your preferences. But I think overall, this type of disease, there's no treatment for it really. And I think it's going to keep on progressing, which is why, I wanted you to see Dr. Young about the lung transplant. And I know you saw him once, I think, and you said you wanted to just kind of put everything on hold.
Okay.
So what I want to talk to you about is kind of what you want to do. I think although you did seem to respond, you had some improvement in your breathing test, and I think some of your symptoms too with the higher doses of prednisone, it has a lot of long-term, bad side effects, and it's not something that we can maintain at a high dose for a long time. You're now on a kind of a lower dose for sure, and one option is to add on a different medication that helps kind of tries to suppress the inflammation that's kind of causing the scarring to progress. Again, there is really no good data or proof that it even works.
Okay.
You know, it's literally just small case reports and case series and things like that. Because this is a disease where there really is no established treatment at all. And so, you know, doctors, when you see things get worse and there's no treatment for it, you know, you're going to do what you think may be helpful. But these medications, you know, they're not steroids, but they do suppress your immune system. And so they have their own risks, mostly like risk of infection, and along with the prednisone too. It can suppress your bone marrow, so you have to monitor your cell counts with blood tests. And then some of them, you know, there's some concern that over the long term there's some slight increased risk for different types of cancers, especially like blood cancers. And then the usual kind of GI, you know, upset stomach, that kind of thing, side effects. So that's one option, to add on another medication, which I don't think is unreasonable, but it depends on how you feel about it. I do feel like, though, the likelihood that you'll have any sort of meaningful response to me is probably kind of low. And I think the most important thing you could do is probably get back on the transplant evaluation.
Okay.
But, you know, this is just, you know, you have to let me know kind of how you feel about it. Because no matter what you choose, whether you don't want to be on any more medications, or you want to try this other type of medication, or you want to go forward with a lung transplant eval, you know, I'm definitely here to help you out, however.
Okay, I think we should get back on the evaluation part.
Okay.
At least evaluate and see what I need to do.
Okay.
Instead of waiting
Right, for the lung
for
transplant.
the lung transplant.
Yeah, I totally agree. So what we can do is, what you need to do is basically contact Dr. Young's office again. You have their number?
I don't.
You don't? Okay, I'll have
Once
to get it
again,
for
yeah.
you. But you've already seen him for sure, right?
I've seen him once.
Okay, so you'll have to get back in touch with him, let him know that you want to go through the lung transplant evaluation process. And with your insurance, you can actually just do all the evaluation through UCSD, like all the blood work and everything, and it'll just be easier that way, because then they'll just have it within their system. So they'll let you know exactly what you need to do. So I think that's fine. You know, it's not something that's going to be done like in a week or two. There's a lot of different tests you have to do. I'll also write my note today, obviously, and I'll fax them over all your different breathing tests and stuff like that, so they know kind of what's been happening. What about the other medication? Is that something that you want to try to add on?
Well, I mean, that's up to you. I mean, I'm just,
Okay.
you know, if that would help me breathe a little bit better. Then.
Well, I think the main reason why you would do it is to try to see if it could possibly kind of stabilize the decline in your lung function, meaning the scarring, meaning, you know, let's say if we did nothing, you know, and I saw you back in 3 months and we repeated the breathing test, I'm going to guess that it's probably just going to look worse than it did today.
Yeah.
I think the main goal of adding on this other medication would be to see if we can maybe stabilize things. Meaning, if we started you on the medication and then I saw you back in a few months and we repeated the breathing test, maybe it'll look stable, like not any worse. Maybe it'll look better. I don't know. We would only really know until we tried it and basically see what happens.
Okay. Can
If you want, the medication I'm thinking about is something called azathioprine, and if you want, well, first of all, before starting it, I need to check a blood test, because there's different people kind of break down the drug differently. So there's a blood test that tells me if you would be at higher risk for suppressing your bone marrow too much.
Okay.
So I'd like to get that blood test. It probably takes at least a few days for those results to come back, because it's kind of a specialized test.
Okay.
In the meantime, I can print you out an information sheet about the medication so you can read up on it a little bit. You can also do your own research about it too. And then once I get the blood test back, I'll call you we'll kind of discuss it, or whether you want to start it or not.
Sounds good.
How does that sound?
Sounds good.
Okay.
Sounds really good.
All right. Do you mind sitting up here?
Yep.
If you want me to talk to anyone in particular, like your family, I'm happy to talk to them too. Okay. Deep breath. Are you still working and teaching?
Still working,
Okay.
but
All right.
not as much, and then I get exhausted.
Yeah. Okay. Here.
It's yeah.
The one thing that I notice actually you're not on that you probably should be is some sort of acid blocker, like a stomach acid blocker. And
What is that? What is that?
like
What
it would
that do
be,
for me?
what's that?
What would that do for me?
Well, there's some research saying, a lot of people who have kind of like lung fibrosis type of lung diseases, tend to have a lot of reflux,
Okay.
which basically means like acid from your stomach that kind of comes back up your food pipe. Normally that causes stuff like heartburn,
Okay.
which you may or may not have. Do you have heartburn?
I don't, but I'm
Okay.
starting to, when I cough, I'm starting
Yeah,
to.
right. And so some people feel like that acid reflux, acid reflux can be a very common cause of coughing. And and some people feel like with a lot of coughing, you actually cause more lung damage. I think it's basically just a theory.
Yeah.
But a lot of times with people with pulmonary fibrosis, we will put them on acid blockers.
Okay.
So they're all actually over the counter. I can try prescribing it, and I don't know if it's going to be cheaper for you to try to get it as a prescription or just like over the counter, like at Costco
Okay.
or something like that. So you can see. Do you want me to try to send it to the pharmacy?
Yeah, just go to send it to pharmacy.
Okay. Let me